Hello, everyone, and welcome to my presentation on risk factors for Torsade. I am your presenter, Dr. Jennifer M. Jones. Today we're going to first look at the definition of Torsade. And so it is a life-threatening heart rhythm disturbance where the heart's two lower chambers beat faster than and out of sync with the heart's upper chambers. The lower chambers are called ventricles, and the upper chambers are called atria. And so let's take a closer look. The heart is the center of the circulatory system made up of blood vessels such as arteries, veins, and capillaries that carries blood to and from all the areas of the body. The blood itself carries oxygen and nutrients to your organs so that they can work effectively. And so the heart's electrical system controls the rate and the rhythm of your heartbeat. And so a steady heart rate should maintain 60 to 100 beats per minute at rest. And so the heart rate is the number of times your heart beats per minute. And the heart rhythm is the synchronized pumping action of your heart's chamber, i.e., the atria and the ventricles. And so let's take a closer look at the heart. And so in the heart, conducting cells carry the heart's electrical signal. And so muscle cells enable the heart's chambers to contract. This contraction is triggered by the electrical signals. And so the electrical signal is what triggers the contraction of the upper chamber. Remember, we call these atria. And the electrical signals also triggers the lower chambers, called the ventricles, as we mentioned. The electrical signals start at the top of the heart at the sonatoria SA node, also known as the pacemaker of the heart. The electrical signal then travels down through the heart, triggering the left and right atria to contract, pumping blood into the left and right ventricles, causing them to contract and pump blood as well. So one cycle of this entire process results in one heartbeat. More specifically, once the electrical signal causes the atria to contract, pumping blood into the ventricles, the electrical signal then travels to the AV node, which briefly slows the electrical signal down. So the ventricles have time to receive the blood from the atria. The electrical signal then travels down the bundle of a bundle of conduction cells called the bundle of His, which divides the signal into two branches. So one branch goes to the left ventricle, and the other branch goes to the right ventricle. And so in looking at that, when the ventricles contract, the right ventricle pumps blood to the lungs, and the left ventricle pumps blood to the rest of the body. So what we're discussing here today is very brief and a very simplified version of these amazing processes, but we can clearly see why it is important for the heart to beat in an organized rate and in a synchronized fashion. If it does not, the patient is deprived of oxygen, and the body's organs do not receive the nutrients or the oxygen necessary to sustain life. Not to mention, the most important factor is that the heart stops working. And so how does this relate to psychotropic medications? And so the body's heart rate is controlled by the sympathetic and the parasympathetic nervous system. So these systems have nerve endings in the heart. And so hormones that play roles in this process are epinephrine and norepinephrine and the catecholamines, basically. The hormones circulate in the bloodstream, and the sympathetic nervous system is triggered during stress. And so it sends a signal to your heart to increase its rate. And so during this time, norepinephrine is released into the bloodstream, causing the increase in the heart rate. So the parasympathetic system, which is activated during periods of rest, sends signals to your heart to decrease its rate. And so now tricyclic antidepressants, for example, they put the patient at a higher risk of TDP. We're going to refer to Torsade de Pointe as TDP. And so, in addition, um, this lowers the potassium and calcium or low magnesium. And so, you want to look for that in patients. That's a kind of a signal to let you know that something may be going on if they have low potassium, calcium, or magnesium. As well, patients with liver or kidney disease, you want to be mindful of this in them as well. Although not discussed in this discussion here today, also keep in mind that certain anti-arrhythmia drugs designed to restore a healthy heart for people with arrhythmias can also be associated with TDP. And so we want to talk a little bit more about the psychotropic medications and their role in TDP. And you can see a list of those on the slide. So also, another note, women are said to be at a higher risk than men at ever having TDP. And so you want to keep that in the back of your mind as well. And so psychotropic medications, as I mentioned, are listed in the slide. And so medications that are tricyclic antidepressants or antipsychotics are medications that you want to keep an eye out. And so medications that are dependent on the CYP3A4 enzyme have historically caused fatalities and have resulted from administration of substances that inhibit this enzyme. So negative outcomes can occur when administering medications at the same time as other medications. So the important takeaway here is that some medications are independently of concern for causing TDP, but other medications are not, but become major concerns when prescribed with other medications that when combined decrease the CYP3A4 enzyme. And so that's effects on the potassium and sodium channels and their ability to prolong the QT interval, which we will discuss in more detail in a few minutes. And so one medication that has been mentioned by my authors to be safe is aripiprazole. And so keep that in mind as well. And so when you want to look at diagnosing signs and symptoms of TDP, it can come on without warning, unfortunately. And so sudden feelings of the heart beating faster than normal, or even when at rest, feelings of lightheadedness, feeling faint, cardiac arrest, sudden cardiac death. It is possible to have one episode or more than one episode of TDP. And so the body can resolve these episodes itself fairly quickly in some cases. And when this occurs, it's called ventricular tachycardia unsustained. In general, an abnormal heart rhythm is called an arrhythmia. So when the heart is beating much faster than normal, this is when it is referred to as tachycardia. And so Torsade de Pointe, or TDP, is considered an unusual form of tachycardia. So when it does not resolve on its own, it leads to a serious heart condition called ventricular fibrillation, which is what leads to cardiac arrest. This is what we're referring to when we mention the heart suddenly stopping. And so once the patient reaches this point, unfortunately, is usually fatal in most cases. And so how you want to monitor TDP, because the heartbeat is controlled by electrical signals, an electrocardiogram, EKG, can be used to measure the patient's heart's electrical activity. And so the electrocardiogram tracks electrical signals all the way through the heart's pumping process that we explained earlier, from the SA node to the atria to the ventricles, the bundle of His, the entire process. So these signals are displayed on the EKG readout, which you can see some examples on my slide. When TDP is present, the EKG readout will look like what one author described as twisted ribbon, and that's what you'll see on the slide. And so TDP can be a complication of long QT syndrome, which is a genetic disorder inherited that can be triggered by medication. And so Q and T are two of the five waves that are tracked on an EKG. And so on my slide, the image only shows four of the five. So the electrical activity in the heart that occurs between the Q and the T waves are called QT intervals. And so a QT interval is measured from the start of a Q wave through the end of a T wave. And so when this interval is abnormally long, the patient is at a higher risk for ventricular tachycardia or TDP. Um, and so one of the things we mentioned, the potassium and magnesium, and so those chemicals are displaced in the heart when you're seeing this long QT interval. That's what's happening in the heart, is that these they're blocked, and that's what the challenge is. And so long QT syndrome in and of itself does not always lead to TDP. And so when we're looking at treatment, once a patient is diagnosed with TDP, make sure to check the patient's potassium. So it's a decrease in the outward current of the potassium. And you want to also check the magnesium and the calcium, as I mentioned, because it interferes with the inward flow of these items. So remember, I mentioned earlier that patients with low levels of potassium and magnesium are at a greater risk. Check calcium levels as an added precaution. You will want to prescribe supplements to increase the patient's level to a healthy range. You may also want to prescribe the patient an antiarrhythmic medications to help resolve the current TDP episode and hopefully prevent any future episodes from occurring. So beta blockers are also prescribed, specifically isoproterenol, to treat TDP for the long QT syndrome symptoms. So in conclusion, you want to get a good medical history from your patient, to include any family history of sudden cardiac arrest, any history of their own related to this disorder, history of syncope, and or any resuscitated arrest. So anytime their heart may have stopped and they were able to be brought back. So any congenital deafness or use of any medications that are contraindicated to cause TDP. So this concludes my brief presentation, and now we will have some question and answer period. So please note, this is not new information, but it's information that I gathered from my references listed on the slides. I appreciate everyone's participation in this presentation. Thank you for coming out today as I presented on risk factors for Torsade de Pointe. I am your presenter, Dr. Jennifer M. Jones. Everyone be well.